Well, I'm totally privileged to have a chance to present here of our pilot data. And after 30 years of research, and I couldn't be more humble to share with our data, and also admitted that I'm eternal students in front of such a complex disease. Well, I got impressed just for the first session of presentation here, and I'm a little scared that when the Silicon Valley technology invade our medical community, whew, so that's something that we have to change. Just look like when you look like PayPal, they change our banking system, and Elon Musk changed our driving habit, and I know our medical future will be very different. Certainly the brain future will be very different when they come in. And I'm so glad that Dr. Insel get into this field and leading us to a next era. And the second impression I got here is our first presenters was inspired by his father, and then tell him how optimistic the future can be, and the brain is infinitely smart and you can do a whole lot. But unfortunately, my parents were not that encouraging. When I was just at the last year of my medical school, I decided to quit my cardiology professions in the future. I decided to be a psychiatrist. And I remember I was in Shanghai, China, 30-some years ago. And my father was a philosopher, so he looked at me and said, choosing psychiatry proves how dumb you are. No offensive. But he said the second question is even more challenging. He said, what makes you to believe you can use your dumb brain to figure out why it's so dumb? And now 30 years passed, still asking me, have you figured out yet? No. I don't know. But again, and I'm trying. Let me see. Oh, there's a nice. Okay, so in the booklet, my topic was listed as an innovative technology. I don't think so. I changed my titles. I don't think this is innovative that much. I will say it's more of like a renaissance of a classic science. So that, as a previous panel discussed about this in a large database, that kind of idea, I think this is a great, it was based on a very traditional medical model that medicine is a imperative, evidence-based approach, which is, to me, no difference from individuals' physicians' experience. You just collect a lot more data. It doesn't matter what is the mechanism of action underneath there. I think this is probably the time for us to look into the science behind the brain, okay? Just like my father challenges me, I'm a dumb, why? And I can work on that. And there's a more civilized way to describe it. If the brain were simple enough for us to understand it, we will be too simple to understand it. Sorry about that, and could be even more pessimistic. And then I also heard another presenters talk about the emotional brain, and also talk about the rational brain and the memory brain, as if like the brain is pre-designed by somebody with all these functions in the different structures. Here is a neuroscientist quote. He said, there is no good reason to assume that the brain is organized in accordance with the concept of a folk psychology. I don't think the brain is created that way. Let me give you one example. We have a visual cortex in the back of my brain, right? What if you were born with no vision? You're blind. What do you do with that piece of an organ, piece of a tissues? Now, we have evidence to show that if you don't have eyesight, that piece of tissue will immediately turn into some other use. And we already sort of demonstrated when we stimulated the blind patients with auditory stimulation, their visual cortex line up. So that's quite amazing. And So the things is that my challenge here is that, is there any law of the nature that governs the brain to work the way we want? So the usefulness itself doesn't necessarily mean the function of a brain. For example, when you get a concussion, okay, or when you get a stroke, let's say you block one vessels and it hurt a small piece of your tissues. If you only measure the amount of a tissue that has been damaged, you will not have a problem with paralyzing the entire side of your body, right? But why that? Now we have a better neuroimaging technology. We have our EEG, which I'm going to talk more about it. You will see that when you have that impact, even if it's such a small, like a tip of your finger or even smaller, your entire brain will suck into that state of default state. What in NYU group already described this as a default state, and immediately compensate the impact. But what's more interesting in that, these are the neurons are pretty intact, but why do they get into that state? So now more and more physics data sort of start to support this idea that our default state of a brain doesn't necessarily mean the best state for you to use. Okay, neuron has their own interest. So my other sort of philosophical debate is that my consciousness is a product of our neurons, but neurons are not conscious. They have their own reason to survive there. So let me show you some of the physical nature of the brain. Okay, what does a brain mean? To me, brain is no different from just a blob of fat, just to put it there, right? So when you measure my brain, you will see it's roughly 3 pounds. So that's equivalent to 2% of my body mass. However, because we have such a large quantity of neurons, it consumes about 20% of a total energy budget of my entire body. It's ridiculous, So there is a book from MIT. They call this the brain is a selfish organ. No matter how dumb I am, and it just suck up that much of energy. So that if I take a bowl of a pasta, half a bowl get into my brain, even if I'm just eating there, doing nothing. So that's how it is. So if I have a way to put a probe into my brain, it's equivalent to 25 watts of an engine constantly running. Okay, it doesn't matter what you're doing here. You're writing, you're listening, or you close your eyes. That's the same amount of energy you're doing there. So that my question to me, based on my high school physics, how does the brain dissipate the heat? You drive your car, the combustion engine, you have a coolant, right? You have a cool, very cold water get into the engine, pull the heat out. And you have a radiator, you have a fan. But our brain is not equipped with any of these. The brain stays in an insulator. A couple of years ago, I was invited to travel to Kazakhstan. I don't know if anybody ever been there. There was 65 degrees below. Fortunately, my brain, wasn't frozen. Simply because I have an insulator, right? I didn't go through that. My heart, my blood is not a coolant. It's a warm liquid. There is no temperature gradients. 98 degrees pumping out of my heart, going through my brain, coming out still 98 degrees. So the heat is not carrying out. I don't have fan. I don't have a radiator. So the brain got to find a way to cool off. Now, the second question I have is I really don't like the neural mapping idea, okay? I don't know if everybody is aware of this. In this piece of a blob, 3 pound of blob, there are roughly 100 billion neurons in there. Okay, 100 billion neurons are huge. One of the scientists here talk about genetic measure. We have a couple 100,000 genes. If you measure every base pair, you stretch them out, that's a 4 billion for most of the women. Man is a little inferior. We have a 3.5. Okay, but regardless, that's a huge amount of a number, but still, compared to our neuron, it's trivial. We have 100 billion neurons in there. And each neuron, we have another 10,000 of connection to our neighboring neurons. Okay, 2 questions I would like to raise here. One is the signal-to-noise ratio. Let's say I want to talk to the lady back in the room, At the same time, all 10,000s of people connected with me. And she has the same amount of neurons, neighbors connected with her. I want to talk to her over the phone. Each time when I say hello, all 10,000 people will cheer or shouted, right? And then she will hear the noise just as much as I want to tell her. And once she communicates with me back in the same way. So the question is, what is the how high is the signal to noise ratio, right? Second things I have is that anybody questions what is the frequency bandwidth between two neurons? And then for some of you, probably you don't care about that things. Let's say I have a cell phone, okay? Sometimes I throw the cell phone on the ground because it's too slow. But anybody questions how fast the cell phone can process? That's a gigahertz, meaning that every second you have more than 1 trillion bits of information going through that processor. So I happened to work on the fruit fly before. I measure the neuron, one neuron to the other, through the synaptic connections. So the neuron works like this. I want to connect it to you. Then I fire electrically and then release a whole lot of chemicals on your side. You receive the chemicals and you respond it. So I just put 2 probes in 2 neurons and stimulate this and then measure the others so that I can tell how fast the neuron will pass the information from one side to the other. No matter what I measure, 50 milliseconds is the fastest I can go. Okay, maybe for you as a biologist or as other professionals, and you probably think 50 hertz is pretty fast. No, it's horribly slow. I'm not kidding. If you look at the frequency measures as 1 over 2 pi tau. Tau is the time. So the conclusion is that the frequency you can pass is about 30 hertz. And then based on the Shannon's information theory, you have only 15 hertz of information you can process through your neuronal connections. I can't even stand for 1 trillion bits of information per second on my cell phone. How is it possible in the brain you can handle this much of information at the 15 hertz of a transmission speed? So none of these things works for me, okay? The brain is too hot, the brain is too busy, too noisy. Whatever we have done so far, it's not an answer. Okay, the good things is that we found some scattered evidence that the brain probably will have a way to deal with all these things. First of all, a little bit here. So that we measure the EEG. Okay, back to the old time again. I have a little connection with the Silicon Valley too, and we, back to the 1980s, we at UC Irvine, department owns a very large cyclotron and PET scan. So I happen to have a chance to play that kind of gadget by injecting the isotope into the vein. We have students to play Tetris. I know by your standard, the game is too primitive. But the Tetris itself can tell quite a bit of how you execute your executive functions, your working memory, that kind of thing. So we found that, the glucose level is inversely related to your performance. And it's not really the hotter the brain, the better. Actually, the other way around. The cooler the brain, the better. And then at the same time, I happen to have a chance to record their EEG. And we found a very interesting phenomena that if the EEG, there is a very unique wave we call the alpha wave. The alpha wave is inversely correlated with the glucose. The higher the alpha wave, the lower the glucose metabolism. And this one was later verified by various different groups. Of course, the other way to cool off the brain is by nocturnal sleep. And then this is very important. If you don't sleep well, then you'll pay the hot brain price. And then this one I will later comment on why we have a PTSD, we have so many mental disorder. And the second thing we found that this alpha wave, which I was just talking about it, correlated with your glucose metabolism. Now we found that this is the one that really related to your cognitive functions. And study shows that when you present a cognitive challenge to your perceptual channels, your EEG will respond dramatically in this alpha wave. And the other study shows that the load of a cognitive task is proportionally related to the amount of alpha wave generated from there. And my own study shows in the visual reaction time, and that demonstrated that the higher the Q, meaning that the higher the frequency selectivity, the better the response. Now we use this to work with our professional baseball player. Oh yeah, you can tell. These brains are, I mean, these baseball players, not you and I can do that easily. They were born with a unique frequency selectivity so that they can handle 96 miles an hour type of a flying ball in such a speed. I can't do that, okay? Okay, the hypothesis here, what I have is that, the brain is obviously a slow burning machine. It's not really like a combustion engine. So that's an isothermal machine. So isothermal stability in the brain is partially maintained by synchronized local field potential, which we call alpha EEG. And so that a coherent EEG gates neuronal firing. So that this is the idea that I talk about. That information cannot be transmitted on a single neuronal base, on the network base. So that how's the information encoded? So we hypothesize that information is encoded in space in a huge, massive parallel fashion. And then the idea is that, the combination of a variety of neurons in a different area, that's the way to cope with the information. Now we found that the common wave that carried out the heat dissipation at the same time is the way to encode information by gate the different area to fire together wirelessly. That's very important, okay? It's not connected by a network. Now I can afford to lose a lot of neurons. Anybody know how many neurons we lose every day as adults? 80,000 a day. Okay, we're losing a lot of neurons. Guess what? We have 100 billion, so we can afford to lose that. The beauty of this is that the information is not encoded in any circuitry. So even if you lose that, I still have a lot of redundancy to cope with it. If it's a linearly planned in the circuitry, the chance to hit that is very high. If we lose that, we break the circuitry, then nothing will work. But fortunately, it wasn't designed that way. So that's how that gives me that. And based on that hypothesis, we can tell that irregular EEG or local field potential increased brain energy consumption, so the reduced efficiency, and then the information cannot be encoded properly, and then you will have anxiety, schizophrenic symptoms, all kind of things, okay? So MRT is another unique way to tune the brain, okay? So that's how, back in 1980s, I started this photic driving idea. I use light stimulation to try to tune the brain. Remember, based on the same problem, that when the neurons swap in our thalamus, and then you lose the information. So that I have to find a way to directly perturb the brain. So that's how we started the idea using transcranial magnetic stimulation. So this is the model that we have developed. I measure their brainwave, okay, and I measure their heartbeat. Then I calculate the mathematical relation between these two measures. And I let these biological matrix to drive my magnetic machine. And that feedback by a very, very large coil. If you're familiar with this transcranial magnetic stimulation, it's called TMS, they use a very powerful magnetic pulse, but I don't have to do that because I already know the intrinsic frequency. Just like when you push a pendulum, you don't have to push a pendulum with a 100-pound force on the kid. You can use 2 fingers to push it. But the trick is that you have to push exactly the intrinsic frequency of the slope. So in that case, now we know exactly what the frequency is. So we use a way lower intensity to push it. And so this is the panel you will see. So here I like to present 2 studies. The first study was a double-blind study on autism. In autism, as you know, they are very, very hard to treat. And as of today, we treated about 1,300 autism. And this is a 28 patients, double-blind. And you can tell that this group of kids on placebo, the first 5 weeks, on the double blind has no change at all by symptoms. By the way, this autism rating scale, if you go above 37, that's a very severe, and this group is very high, around 42. No language and not potty trained and that kind of people. Then I train them, the active group, 5 weeks later, you can tell this dramatic drop of symptoms. And then I open the label for everybody, let them treat it. And then 10 more weeks later, you can tell the symptoms drop more than 60%. And then on autism rating scale, if it's below 30, that's normal. So based on the standard deviation, we have more than 42% of them become neurotypical. Basically, they're from a special education program getting into mainstream. And then we follow them for 12 more weeks, and you can see that continue to improve. But the beauty of this is we just finished our 1-year follow-up. 4 more patients who didn't respond in the beginning that much joined this responding rate. So as of today, we have a 47% of the patients become neurotypical. This never happens in any other places. And this number resembles exactly our clinical data on that 1,300 cases. So the beauty of this is now we can proliferate the technology through our Silicon Valley technology by cloud system. Now I have 10 clinics worldwide, and everybody is doing the same thing. So these are the data, and then you can tell the EEG variation. At the beginning, the EEG like this, and after treatment, the frontal lobe increased dramatic amount of alpha wave, and because we borrow the alpha wave and the heartbeat and tune the frontal lobe, I push the alpha wave going up, and of course, based on my hypothesis, that worked. Okay, second study I'd like to share with you. As you know, the PTSD in our veterans is such a big deal. While we're talking here, and several people already killed themselves by suicide. So this is the things that we feel so heavy, then we have to deal with it. So now we just dump all our profit from autism study into a PTSD. So in the past 3 years, we treated 250 severe PTSD veterans, and then approximately 100 of them are suicidal. Now they're all living, and 15% of them are already hired by us and working with us. So I cannot be more proud of it. So this is a study, also a double-blind, severe PTSD. Actually, it's an interim analysis. So we intend to do 100 cases. 2 weeks of treatment, you can tell a little placebo effect, and then they reach the plateau by 2 weeks. And the treated group continued to improve. Open label again, they all drop. As of this level, 4 weeks later, 61% of our patients responded. Okay, this is not trivial. So based on this, and now VA, we just finished our meeting with the secretary of a VA, and then we're about to sign a contract with them, and then to see if we can quickly proliferate it to a much larger group and to help them. And this is our EEG, and then in the earlier presenters, if somebody talked about the Loretta, now one of the Loretta inventors is my co-workers, and then we developed this new Loretta called S-Loretta, and this is a sort of a low frequency in our patients, and after treatment, low frequency disappeared, and symptoms improved. So conclusion, first principle of physics works for the brain as well. Thank you very much. I'd like to answer a couple of questions if you have. Okay.
These were incredible results, outcomes.
Thank you.
Just so many people, such easy relief, and amazing. How's it looking over time as far as the stick-to-itiveness and your following and how people's health working?
Yeah, and then this is just a 2 study I'd like to share with you, but we have treated many patients for schizophrenia, and we treated about 150 cases. 55% of them responded by 30% improvement, and everybody relapsed when we stop the treatment. When we treat 400 cases of substance abuse people, 72% of them responded by comorbidity measure, depression, anxiety, and sobriety. Everybody relapsed in a year. And autism continued to improve for a year. Nobody relapsed. And PTSD, half and a half. So we don't know. And then at this time, I think the PTSD diagnosis probably is not homogeneous enough to really address that. And then the beauty of this is we treated 14 comatose patients. And the Glasgow score varied from 3 to 8. Now they all wake up, and none of them relapse.
Yeah, I agree. That's very exciting. The autism, you have a lot of data on those, obviously.
Yes.
Do you have any clues yet about that differentiate those who respond from those who don't respond?
Not yet. This is a very, very challenging question. A lot of people come to us and say, can you tell who will respond or not? And we only found that age has some effect in there. But as overall, if you treat them for four months, and then almost no difference. Everybody responded in the same way. And the younger people, we treated as young as 2, and they almost responded immediately. In a way, we have one kid, 4-year-old from Panama, never talked in 4 years. And then just after 1 day of treatment, she started to talk in both English and Spanish. So I really don't know how to answer that. But the older people, and we believe that they have a little coping mechanism. When they learn their coping mechanism, for example, stemming, and then you want to teach them how to unlearn it, it takes a little time. So that they respond slightly later, but overall, if you give them enough time, they all responded, yes.
Are there any side effects to this, like ECT, where there?
No, this is they're totally against ECT idea, because
Right,
I did a whole lot of ECT, and then this is based on nudging technology. It's totally non-invasive.
But there are no side effects that you're
There is a
finding?
potential side effect on the seizure, but the seizure, actually, the rate of a seizure happening is lower than Nintendo.
Oh, wow. Okay, thank you.
Thank you.